Thank you everyone for joining us for our second of a three-part panel series with patient and public partners. This session is titled Flourishing Relationships for Online Engagement with Indigenous and Newcomer Communities. This panel is part of the Center for Healthcare Innovation's Patient and Public Engagement Lunchtime Learning Series, which is a self-approved group learning Section 1 activity as defined by the Royal College of Physicians and Surgeons of Canada, and it's eligible for 1 credit hour. We will be recording this panel and we'll be sharing it on our YouTube channel. You have the link to that in the chat, and we'll send it out to everyone who registered as well. So how this panel will work, as participants, your audio and video are muted. Feel free at any time to use the chat box to add questions or comments, which we'll share with the panelists. Panelists will take turns sharing their perspectives, lived experience, and recommendations. If you're having difficulty hearing or would like to follow along with the subtitles, you can turn those on in the More options at the bottom of your screen. If you need help with anything, just let us know in the chat. Here in Winnipeg, we acknowledge we are on Treaty 1 land, home of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence faced by Indigenous people within our systems, governments, and institutions. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. And in talking about patient and public engagement, it is in fact Indigenous research methodologies that are at the forefront, and Indigenous scholars, researchers, and communities that we should be looking to for guidance. Collaboration will help us in healthcare today and for future generations. We also want to acknowledge what's going on in the world. Today, many scientists and research institutions are ceasing their activities in support of the Black Lives Matter movement in order to learn about systemic racism in the research community and reflect on actions that can be taken to address systemic inequalities in science. This is planned by 2 ad hoc groups of scientists, and they're using hashtags such as Strike for Black Lives, Shut Down STEM, and Shut Down Academia. Though we are clearly working today, we do want to acknowledge the ongoing discrimination and violence against Black communities, visible and non-visible minority groups, and those experiencing racial injustice. In the spirit of moving forward in solidarity, we need to reflect on our own prejudice and biases, educate ourselves and others around systemic and structural racism and oppression, and promote social inclusion, social justice, and and equity in our workplace, social circle, and families, as well as in the way we conduct research and engagement. We encourage everyone to seek out education and resources in their own communities and contexts, and continue to speak out against injustices. And I would like to introduce our patient engagement team. Carolyn Shimon, our patient and public engagement lead. Boakai Dukuly, knowledge broker in patient engagement. And myself, Trish Roach, also a knowledge broker in patient engagement and knowledge translation. Our team works collaboratively with researchers, clinicians, and students to support meaningful and active involvement of patients, caregivers, families, communities, and members of the public in health research projects and programs. This includes direct support for development and conduct of engagement activities with diverse groups, facilitating relationships, and the development and delivery of resources, training, and education. Because it is an accredited program, we do need to acknowledge any conflicts of interest. So the PE team, we are paid employees of the Center for Healthcare Innovation, and our panelists, Thomas Beaudry, Boakai Dukuly, and Rasit Eskicioglu. Oh man, I screwed it up. They're members of CHI's Patient and Public Engagement Collaborative Partnership. We do not have any other conflicts to disclose. First up is Rasit Eskicioglu. Sorry, got it now. So Rasit is an associate professor in the Department of Computer Science at the University of Manitoba. He has vast experience working across cultures and a wide range of social, economic, and work experiences. Rasit was born, raised, and studied in Turkey, worked in Riyadh, Saudi Arabia for 6 years, and has lived in New Orleans. He has also studied at the University of Alberta. Rasit, welcome. Thank you very much for joining us on the panel. I see you've unmuted yourself. Thank you. So here, I'll just put up the kind of notes that you shared with us and give you about 10 minutes to share your perspective. So go right ahead.
Yeah, thanks, Trish, for a nice introduction. And I'm looking at the title of this talk today, online engagement with indigenous and newcomer communities. I myself is a newcomer, but I am a mature newcomer because I came to Canada in 1988. And of course, when I came, I had some black hair. Now the hair is almost gone and it is whitish. Now, one thing since I arrived here, I noticed that, and by the way, before coming in, I knew all the issues relevant to or related to Indigenous people, First Nations, both in Canada and in the United States. And I even had read some cartoon books about these relationships, bad guys and good guys type of thing. So I think we are, and living in various countries over my life, I realized that how important the understanding of each other and respecting of each other is, and how important it is. And in that context, I'm not sure I should even consider of my heart any barrier of separation, because I feel I fit right into the community when I first arrived with my two then young school age kids, and we were all welcomed and we appreciated this. And this was one of the many headaches or issues we had, financial issues. We had brought some limited amount of money. We didn't know many people when we arrived in Alberta, but things went extremely well. So I'm really happy to talk to you in this respect as an outsider, newcomer, since I wasn't born here. But given today's pandemic, I think these issues, the engagement issue particularly, is becoming more important, because we lost almost completely the face-to-face or close relationships with our loved ones, friends and families. Unfortunately, I have only two daughters and two husbands and one grandchild. That's all I got in Canada. Actually, it is almost where I was born in Turkey. So it is even more important for me to hug my daughters, hug my grandson, but given the conditions, we couldn't. Even with the members of this group or engagement group, each time we meet, we hug each other and we discuss various topics and other things. The key here is, I think, we have to always keep in mind that we are humans, we can make mistakes, but we need to be respectful. And of course, as a result, we expect a level of respect from others, and loving and caring are other issues that has become even more important in today's condition. And when the new normal will come, I don't know when it will or if it will in the near future. It will take some time to settle things up. We have to be more understanding and we have to be more loving and caring because that's all we got. We are losing contact with our loved ones who doesn't live with us. So we have to learn how to survive and how to be with the ones we can have in today's condition. One of the reasons I decided to volunteer in this community and this partnership was that I love being with other people. I love being respected. I love and respect any other people. And that's all it takes. You don't really need much about. And now that we are only capable of talking or meeting in virtually over the cloud, I think things are becoming more important because that's only what we can do, and we have to continue, and we have to engage even more so in odd means to keep up and keep going. I think this is something I would like to emphasize. And I don't know. I mean, we always, yesterday I went for a coffee with my colleague on campus. We sat in two different desks and probably about 3-4 meters apart. It doesn't cut it. We need to be closer, but then again, we have to respect. I think the whole thing is in this pandemic, if we follow the rules, if we care for ourselves first, then the others' care will come automatically. If we care, if we love ourselves, if we respect ourselves, I think we will automatically be respecting others no matter what. So that is my message for today. Am I on time, or can I talk more, or what?
If you have a few more minutes, if you'd like to share more, go ahead.
Well, I think this is all I want to say at this time. Maybe I could.
I'm sure there'll be questions in discussion that you'll have the experience to speak to.
Yeah.
Okay,
Thanks
great.
again.
Thanks, Rasit. Next, we have Abu. I'm going to just unmute you so you can get a chance to talk. First, I'll introduce you. So Abu is originally from Liberia and has been residing in Canada for over 30 years. He came to Canada as a government-sponsored refugee from Egypt. His educational background is in psychology, with a wealth of knowledge in mental health, working alongside war-affected refugees and immigrants through Aurora Family Therapy, as well as bridging the gap between the Winnipeg School Division and newcomer communities. Abu has a deep understanding of the ethno-cultural communities and context in Manitoba. He has also participated in health research in order to bring light to newcomers' experiences with healthcare and accessing services. Abu has been a member of the Provincial Mental Health Board as well as the Provincial Board for Immigration Policy. He continues to bring Indigenous and newcomer communities together through the Stronger Together initiative. Abu, welcome to the panel, and thank you for taking the time to share with us. And I did get that correct. You're from Liberia, is that correct?
That's correct.
Great. Okay, so yeah, you have about 10 minutes, so please share your thoughts and perspectives with us.
Thank you, Ben. I appreciate that. Really, first of all, I want to say thank you for everybody who is participating in this forum today. And it's really my pleasure to be here to share some perspective of the newcomer community. And I must say, the newcomers community is as diverse as you can imagine. So the perspective that I'm going to express here today is just probably a fraction of perspectives in terms of a newcomers community. However, you will find aspects of this that is related to every newcomer. So in that sense, I guess you can see where every newcomer is connected and where we are disconnected. So talking about ways to enhance relationship with either the healthcare system, the educational system, and helping to erect positive relationships that will benefit everyone. You see, first of all, there are categories of newcomers that we need to understand. And these categories are important because of the way each of these categories engage with the society or community at large. So when you understand these categories, then maybe as you encounter anyone from that category of people, it gives you a better sense of who they are and why they are here and how they became part of this community. Now, from our perspective, myself, I come from the category of government-sponsored refugees, meaning those who were either displaced from their homes or they were targeted because of their ethnicity, because of their religious affiliations, or because of their political association, etc. This category in this province, this category represents probably the biggest category of immigrants in this province, or newcomers, in the recent years. So the reason why this is important is that this category represents the group that has what you would call a high need. This is the high need group, because these people are usually either coming from refugee camp or from displaced camps from other places where they were forced to settle before they were brought to Canada. And usually coming to Canada or the United States or Europe, the United Nations refer to that as durable solutions to our problem, meaning with all the upheaval, whatever that led to us becoming refugees cannot be solved other than putting us in a new environment so that we can start all over. That is the purpose of bringing us here or resettling us. So they refer to that as durable solutions to our problems. Now, the other category here is the immigrants who voluntarily choose to immigrate to Canada, either for educational advancement, economic prosperity, etc. In other words, it was a voluntary decision they made purposely to come to Canada. So that category of people usually are considered the elite group. In other words, most of them come either equipped or prepared or can fit into the society a lot more easier than the first category that I mentioned. Simply because in the latter case, most of them either have post-secondary education or higher, in some cases a terminal degree in their own fields. Now, the only thing, the immigration aspect that we all share in common is we have all come to a new country. We have all left what we knew behind us to a new place. In other words, we all need to integrate into the society. Now, because of the way we enter Canada, we can also integrate differently and separately for the following reasons. Refugees that come, usually most of them will require language training. Most of them will also require job training. And so the culture in the two groups are so different that the manner in which they integrate differ as well. So for someone who was here as an international student or who came here as an economic migrant, the perception of what Canada is different from the perception that I had as a government-sponsored refugee coming to Manitoba. Now, maybe my case is not a representation of the vast majority of government-sponsored refugees that come to Canada, simply because when I came, at least I did not have to learn the language, which is the English language. I could speak English, I could read English, I could write English. So my challenge was not as challenging as many other government-sponsored refugees who come to this country. Now, nevertheless, the the process of acculturation and the various phases of integration were all the same, besides the language aspect, because then, you know, you have to develop a new mindset. You have to develop a new ways of doing things relative to raising your children, your relationship with the society or the community that you find yourself in, and how you interact with the society at large. So with all of this said, what we all have in common, I mean, these two categories, what we all have in common is our path to integrating might not be the same, but the end game, the end objective is the same, meaning we are all striving to be better than what we were from where we came from. That's what we share. We share that objectives. Now, because most of the refugees who come to Canada were ill-prepared. By ill-prepared, I mean people were uprooted. People were, you know, coming from school in the afternoon and come home and found the village on fire. No time to pick up documents. No time to pick up your degree if you had one. So now you come to Canada, you have to present, or you have to prove that you did have some level of education. You need to prove that you were doing certain things to get certain things here. So that interaction with the system is where the challenges begin to pop up. So, you know, and first of all, you know, one of the challenging aspects of my integration was, you know, I had this perception of Canadian, and I thought a Canadian was just a, you know, white, blue eye, you know, person, because multiculturalism, the concept of multiculturalism did not exist in the universities that I existed in before coming to Canada. In Egypt, everybody looked the same. And in Liberia, where I was born, everybody looked the same, almost speak the same language. So arriving here, seeing different people from different backgrounds, but they're all Canadian, was relatively new to me. And I couldn't wrap my head around the fact that, how can you come from China and you are Canadian? How can you come from Liberia and you are Canadian? How does this work? So it took me a while to get used to that. Now, the reason why this is important is that in my mind, it creates an artificial superiority between myself and the community that I'm dealing with. You know, if I go to a place and I encounter, let's say, a security guard, for me, that security guard represents authority. That security guard represents oppression. That security guard represents all the things that I hated, all the things that made me a target from where I came from. Because people who did those things to me and others are people who wore uniform. I didn't know the difference if whether it says guard or it says whatever company. I know if you wear a uniform, you represent one of those people that I was running away from. In other words, everybody that is in authority, we are afraid of them. You know, so in order for me to be comfortable, to accept that where I am, I'm actually safe, it really require an intensive sort of a reorientation as to, you know, what is normal here, what is not normal here. But you have to remember, for someone who has lived, if you were 30 years old or you were, you know, 40s, you've had all of your life oppressed. You have had all your life being told what to do. You've had all your life being told what is right and what is wrong. You had zero say in anything, in any aspect of your life. So you can sort of understand why that will be challenging and why that's difficult to accept. And now this experience can be found in almost every interaction. And I mean, in the schools, you look at the teachers as authority figures, the secretary in the school, everybody. So overcoming that, the manner in which people overcome that might be different from one person to another. might be threatened to one person, from one person to another. I mean, you know, my wife, we've been married for about 21 years now, and every day she says to me, Abu, I don't, you know, don't feel that this is strange. I'm still afraid of when I see a police officer with a sidearm. I don't know. It just brings back that fear and that anxiety. And I said, honey, you've been here for almost 20 years, and you still, she said, you know what? I don't know. It's just something that I haven't really overcome. So for us, navigating the system it takes a really, really long time, because if you are an economic migrant and you are here, you establish a business, or you are in a given sector, as you grow in that business, your integration into the community advances and less stressful, because then you have a particular sector that you are trying to settle in. And so, you know, maybe 1, 2, 3 years, if your business grows, etc., you can also become a lot more settled and you know, in a less stressful way. So for us, our relationship with everything we encounter, and I mean the first group that I talk about, which is the government-sponsored refugees, the integration for us is harder, and in most cases it's longer. So for us, what we need, and for everyone who we encounter, you know, in order for us to feel safe, in order for us to feel comfortable to say, yes, I think I'm finally in a safe place, you know, our interaction, we need to feel, we want for our interaction to be humanized, meaning the system we are engaging with, people that we encounter, we want them to feel, we want them to make us feel that we are humans. Simply mean, because really what we all share in common as refugees is that our humanity was not considered important to the people who oppress us. Our humanity was what that was taken away. So we had, as a result, we had no voice, we had no say, we had absolutely nothing but our mere existence. So if I walk up to the pharmacist, and this pharmacist sees me for who I am without my color, sees me for who I am without my refugee background, and my interaction with that pharmacist is humanized, where, you know, he chat with me and try to understand where I come from with my broken English or my broken French, and yet does not berate me, does not talk me down because I don't speak the proper English. Then I begin to build confidence. And this is right across the board. If I go to the school secretary, because I'm a refugee EAL student, and then they say, hey, you gotta go to class, and the same things I was running away from, and I'm experiencing that, then it brings me back to that place where I didn't want to be to begin with. So you can sort of see how it's a very simple but complex process. Now, one of the reasons why these things happen usually is the result of what I would refer to as implicit bias. That's when, you know, people are dealing with you with good faith, good intention, but yet they will come across as, you know, really mean or not sincere. You know, I will give a very simple example. Somebody I knew came to me and wanted to sign me up for an Amway thing they were doing. And we talked over the phone. He was really, really lovely. And, you know, we invited him to our house. He came and he was signing me up. And as we went through the sign-up process, everything was done. He goes, where do you work? And I said, I work for the Winnipeg School Division. And he goes, oh, are you a custodian? I said, no. And then he paused, a very long pause. And I'm sitting there in my mind, I'm trying to process the question. Like, Winnipeg School Division is the biggest school division in this province. It's got tons of jobs. Why custodian would be the one that pop out? What did he say? Are you a teacher there? Are you a counselor there? Because in his mind, being a custodian is the lowest of the low in that system, in that environment. So he associated, maybe not even with bad intention, but because of the way we are categorized in the system, that perceive, you know, oh, maybe is a janitor, is a custodian, you know. And so at the end, I told him I wasn't going to take his, you know, I changed my mind because of that question he asked me. And then later on, after like, I think a month or two, I called him back and I told him why I did not want the business at the time. And now I want to reassign I want him to sign me up. So he came back and I told him why I did what I did. And he profusely apologized, and he had absolutely, he wasn't thinking what I was thinking at all. But again, because of usually people who don't know associate immigrants with, you know, cleaning jobs and other many jobs that they don't expect you know. So I was saying, so this process for me was not humanized, because he didn't see me for who I was. He instead associated my status with the kind of job that people would generally associate with people of my type, you know. And so this, in a nutshell, is what that characterized most of what we refugees, particularly government-sponsored refugees, encounter. Now, the reason why I always like to refer to myself as a government-sponsored refugees in whatever I do, because I think this is a representation of what a refugee can become. You know, a young man who came here single, with barely, you know, a university degree, but has managed to fit into the system where he has become a productive member of the society. So really, you know, I have a lot to say. Probably I will have the opportunity to talk about many of those as we get to the question and answer sessions. So really, for me, in the ways, the first step in enhancing relationship with any community, for that matter, is to humanize that process. Because if you humanize the process, then that process, that humanization will resonate with the other person on the other side. And then from there, a lot of things can happen where, you know, the person might feel free to tell you something about themselves. You will tell them something about yourself. And the next thing you look, a relationship has developed. And then you are at ease, he or she is at ease, and then that relationship will blossom as you go along, you know. So I will stop here for now, and then I would like to come back to the other thing that I need to talk about probably as we go through the question and answer session. So thank you.
Thanks so much, Abu. Sorry to have you short on time. Yeah, it's too bad we only have an hour.
That's all right. That's all right.
Great. Thanks for sharing. Okay. And our last but not least, our final panelist is Thomas Beaudry. Thomas is a proud Indigenous man, a proud father of 3, 2 young men and a young woman, and a mashum of 2 boys. He's a graduate of the Center for Indigenous Environmental Resources with a certificate in environmental protection, focused on environmental related issues concerning Indigenous peoples and communities. He's currently employed with the province of Manitoba's Department of Sustainable Development as an engagement and reconciliation community coordinator. His goal is collaboration between environmental and healthcare fields by acting as a bridge, a facilitator in these fields, and with Indigenous people in order to assist in creating a way for healthy people and communities. He is former co-chair of the Collaborative Partnership. And I think we had just some notes there. Okay, Thomas, please share your thoughts with us.
Bonjour, Anin, Thomas Beaudry, Dishnakas. That's about as much as I know of my language because that was taken away from me. So I'm relearning it. In regards to my 2 earlier family members, Rasit and Abu, I'll add to that the respect, love, and caring and about humanization. from an Indigenous perspective in regards to immigrants, settlers, and all that, when we talk about they came to a new country because of the biases where things were happening, that's also with the settler mentality. But we were always here as Indigenous people. We've never gone anywhere. And Canada, this new country they call Canada, was built around us and on us. So how do we engage with that mutual respect? Is just like Rasit and Abu says, humanize us. We are humans first. And one of the things I always say when I'm talking with other people or making presentations, it is time to be comfortable being uncomfortable in our discussions with one another. And what I mean by that, it's all right to feel uncomfortable because that's who we are as humans. But it's how we do start those discussions with respect. When they were talking about being oppressed and marginalized in their country, so they came to Canada to start new. Unfortunately, for us as Indigenous people, we're continued to be oppressed and marginalized due to Canada developing an act that tells us who we are as people, where to live. We have become children in the eyes of the federal government instead of us being human. You know, growing up and going to school and educating myself and working with people, after they get to talk to me and they find out I'm Indigenous, first thing some of them say is, "Oh, you're one of the good ones." So it's like, when I hear that, I kind of cringe up, like Abu says, and I don't want to talk anymore. And I ask, "What do you mean by I'm one of the good ones?" You know? They said, "Well, you speak English well, or you know, you're not dressed a certain way." And I said, "What do you mean by that?" Still, you know, they become uncomfortable. And when we're doing this, like when we're talking about engaging with Indigenous people, it's about respect. But in our culture, we have 7 laws that we try to live by. We call them our 7 sacred laws. It's called love, respect, courage, honesty, wisdom, humility, and truth. If we try to follow these natural laws of how we live ourselves, we try to share that with the other people that come into our world. But we would also like that back. And it comes down to the respect and caring and loving one another as humans first. One of the things is that I'm trying to squeeze as much as I can in within 15 minutes. So I'm trying to look at one of the things I'm looking at connecting with isolated communities. We're going to have to be mindful that English isn't their first language. They have their own dialogue. They have their own communication. But a lot of these communities do not have proper connection to the internet. So how do we have an ongoing dialogue? We still have the old fax machine, some of the communities. Sometimes we won't get it because other people are on a phone line. So you thought maybe you sent it to us, but we don't get it. When we talk about culturally appropriate communicating with one another, let's not be afraid to ask questions of how you want to be dialoguing with us, or how do we want to dialogue with you. You know, don't make an assumption that we know what you're asking. You know, just treat us as a human, be respectful. And when you're going to build those trusting relationships with us, it's going to take time. As Apu said, that when we see people in uniforms, doctors, nurses, security, police, our past influences the way we are today because of residential schools and the way we were treated. So we think those people in authority are going to hurt us or harm us in some way. But we need to build a relationship, so it's going to take time. So come talk to us sometimes, just get to know us. Don't come in there and just open a book and say, okay, this is how we're going to start this meeting. maybe we're saying you're reaching out to the communities. We'd like to come out and talk to you, but maybe ask them, is it all right if we just come and meet and sit and talk and just get to know one another first, so they can develop a trust with you also. It's got to be, we call it reciprocation. When we are asked for something, we would like something back also. It doesn't have to be monetary, but it's about respect. It's one of the things. We want to be treated with love. But it's also to have that courage to talk and have those discussions, you know, honestly. And that's part of one of our tendencies, honestly. And it's so hard to have that. We as people in our culture, we're raised to be humble. We don't want people coming in there like they know everything. We want to see you be humble also. So when we're looking at all these things of how to build and the barriers to engaging with us as Indigenous people, I think you need to look within yourself and see what your bias is. Like Abu said, Rasit, when they first came here, they felt uncomfortable, you know, trying to develop a relationship of that. Well, it's the same thing for us. When we leave our communities, we're coming to a big city. We're feeling uncomfortable. We're not in our area of comfort, which is we're surrounded by our family and our friends and our community. So it's being mindful with one another and trying to help us feel comfortable when we're meeting with you. And how do you do that? Well, understand that some words might be a trigger for us. Like the residential school just didn't impact the ones that went to the school. We call it generational. It impacts us today of how, because our parents lost that connection into their communities, their language, or how to share love with us, you know, embrace us without any thought that, oh, we're giving you a hug, that, oh, you expect something else, or you're complimenting us because you expect something else, or you are talking to us with that, with those words because you expect something. I think don't go and working with Indigenous people to expect something. You go there to develop a relationship with us, to develop a way that we can contribute to what you're looking for. Like, I remember one elder telling me, I think we're the only people in North America who are researched to death, but we don't know any of the outcomes. So, like he said, we know how, but we want to know why you are coming here to do this. You know, so it takes time, you know, and culturally appropriate ways of trying to talk to us. I think each community is different because some of us are traditional, some of us are raised as Christian. So I think that's part of your homework, is to reach out to the communities and ask them, what should we do? Do we bring you tobacco? Do we bring you money? Do we bring you food? Is it appropriate to talk about the culture that way? Because some people that are in a Christian communities don't do that. So it's also up to you as the people who want to talk to us or engage with us or to research us, or to find out what those people, how those people are. And that's where that's time to be comfortable being uncomfortable, is to get out of your comfort zones and ask those questions with respect. Well, you could phone the community and ask them, how do we approach you? How do you want us to meet with you? Is there, do you have a protocol that you want us to follow when we come to the community? Like, I know in one community, the elders, I go sit with the elders when I go there when I'm with work in my job. And some of my government colleagues go, why are you sitting with us? You're supposed to sit with them. You're supposed to sit with us. I said, well, if we're sitting on one side of a table and they're sitting on the other side, we've created a barrier now. That's that table, instead of us interacting. And why are you sitting in those seats? We should be asking the community, is there an appropriate place for us to sit? Because who knows, maybe those my colleagues could have sat in an elder's chair without knowing because they didn't ask. So the elder sits to the outside and isn't participating. That we're there to hope the elder participates. So it's just being mindful about asking those tough questions when we're going there. So when we're trying to build on all of this, like when we first started as a group, I think we were called patient participants, and it took us days to figure our ways of how to come together, and new people coming into our family, we call ourselves. We didn't want to be participants. We wanted, or a group. We called ourselves a family. And if you look at our group, we're everybody. We are Indigenous, we are newcomers, we are settlers, we are the LGBT community. We are people who want to be called who they are. And we're okay with that because we're family and we're accepting. And I think if we can take a bit of that knowledge that we are as a group to accept people for who they are, but not by who they look like, what they sound like, how they dress, I think we would have a better communications and engagement with one another. I think my partner, she's doing a day school write-up on herself, and she's having a hard time. And she said I could share this, and she said, "You've taken my language, you've taken my culture, you've taken me my pride, you have taken my womanhood, but you shall never take my color of skin. I shall carry that with ever. And the other thing is, you might have beaten me, but I'm not on my knees. I shall hold my head up forevermore from this time on." It's difficult talking about that because I have to hold her after she lets go of those things, because it's not hers to carry. It's things that have been given to her. And we have to be mindful, if for researchers, when you come in, that people are carrying these things. And it hurts when we know you're coming in to do research. It hurts that, because back in the residential school, our kids were experimented on without parents' permission. You know, our kids were malnourished just for experimentation for other peoples to succeed. We call it for the colonial and the settlers to survive within this country. So it's a difficult road. I don't know if you can see me or just my picture on there, but I hold my feather with me whenever I talk. That was given to me by my elders to guide me, that remember that we are loved. And that's part of who it is, because love in our is also has the 7 animals, and one of for love, it's the eagle, and that's what this eagle feather reminds me of, that we are loved. So when I try to look at all of these things, everybody says, well, you guys don't pay taxes, you don't do these things, you get free money and all of that. Well, we are the poorest people within Canada. And one of the things we talk about amongst ourselves, well, with my friends, not with all Indigenous people, is that our people is a commodity. What I mean by that are kids in child and family services, health, because they say, well, you're not a provincial jurisdiction, you're a federal jurisdiction, so they fight over money, who's going to get the money for us. We look at the resources. All resources are taken off our land. And so that's another commodity. Canada was formed based on the resources that were extracted. If you look at the nickel that Canada produces, you'll see the Queen on one side, which is the relationship to the crown. And on the other side is a resource that made Canada, the beaver. So we look at that to remember that, yes, that was our economics when you came here. We traded with you in order for the Crown to be successful and new people to come to this country, to share with you, not to be oppressed and talking down to or anything. We agreed to coexist, live together as equals, but with the new people coming here, you were to look after yourselves, and we were going to allow you to use the resources for farming and some of the resources to build your homes. We were going to continue our way of life of governing our people, but come, and each side would come and ask for help when needed during times of famine, during times of medical distress. So we need to get back to that spirit and intent of coexisting. And that's part of our treaties, and how do we go forward? So how do you build trust? I think we need to start going back and looking at how we as people together have created Canada. Like we
Sorry, Thomas. I just is it all right if we start the discussion shortly? I'll just let you wrap up quickly.
I will wrap up.
Okay.
And well, I just realized the time. Sorry about that. So we need to.
That's okay.
So we will look forward to your questions. Miigwech to you all. Love.
Awesome. Thanks so much, Thomas. Sorry to interrupt you. You're a storyteller. I could listen to you all day, but we have a Zoom meeting and we're within those confines right now. And I know that's not usually how we do things when we work in person, but we're trying to just respect everyone's schedule. So with that, I would love to open up the discussion. Actually, we do have question first from Kathy Woods asking about starting to build those relationships. And I think, Thomas, you can speak to this. So to start building relationships, do you need to approach chief and council first?
Well, thanks, Kathy. That's a tough one because governments are told to approach chief and council. So, and researchers are told to approach chief and council. I think when you're going to begin your discussions, you can reach out to the chief and council and let them know that we would like to speak to somebody in there due to respect. But I think the other thing is trying to find the people that are we call them ceremonial people, the storytellers, the people who follow traditional ways or Christian or whatever. We need to talk to the elders. We need to talk to the people that are affected. When you say the chief and council, I think it's being mindful again of who they are. So it's just reaching out to them, letting them know that you would like to reach out, and what way do we need to, who can they introduce us to? You could ask those questions. Is there people specifically in regards to that? So.
Great. I'm wondering, I don't see specifically any other questions. Many, many thank yous though to our panelists in the chat box. I'm wondering if Carolyn Ogai, I know you guys had maybe some questions that some of our other panelists might want to field. Carolyn, do you want to share a question?
Sure, I guess, yeah, thank you so much, all of you, for taking the time to chat with us today. I was thinking of one question all of you were talking about around the recognition of humanity and respect as we grow these relationships. And I know there's a lot of talk sometimes around safe spaces. And now that we've moved online, I know our family has had to move online with our meetings and stuff like that. Are there any recommendations you have around when you unfortunately were forced to kind of do stuff more online, ways in which we can continue to create that safe space for everyone?
Let me give a brief answer, Carolyn. I think there is no excuse not to continue that relationship. It is, of course, obvious it is better to be close to the loved ones or friends and family and such, but it is no excuse that, oh, you are far away, I can't hug you, I can't kiss you, so I'm not going to get involved. I don't like the technology, etc., etc. Unfortunately, the technology is still a big barrier between communities, peoples as such, but I think things are getting more user-friendly, and many people are using, and people learn from each other how to use one or another. I think we should, regardless of the conditions, continue to reach out to our loved ones.
Great. We do have a question from Immigration Partnership Winnipeg. Question to all, mainly Thomas. What are the concrete steps to engaging Indigenous youth and those who are not necessarily connected to sector tables and larger events due to socioeconomic reasons?
Well, we have to be aware that all Indigenous people aren't the same. What I mean by that, we have Anishinaabe, we have the Cree, we have the Inuit, we have the Dene, we have Dakota, Nakota, Lakota. We have people who have traveled from their areas to live within Winnipeg and Manitoba. So how do we reach out to the youth? I think the first step would be to go to the universities and schools, you know, and see if there's Indigenous areas within those universities and schools and the colleges, and ask if you could go speak to them and ask them if they would like to participate on what you're going to do in it, or ask them to help develop what you want to do to go forward. Because those youth are full of energy, and they want to make changes that are going to benefit them, their future generations, but us as are getting older, our elders. So I think that would be a first step, is going to the school.
You got muted, Thomas. You must have muted yourself.
Okay, that's also going when you're going to go ask for the deans, the principals, and all these things that necessarily like high schools. You need to get permission to go there. So that would be the first start, to go talk to these things, and you know, and build that relationship with them of what you're trying to do.
Thank you. We have a couple more questions here. I'm kind of speeding along because I know we're reaching the end of our time. I just want to make sure we have a chance to address these things. How do each of our panelists respond to how their communities would like to be treated during this time of the COVID virus, and how are they treating each other? Do we have a specific panelist who'd like to speak to this?
What was the question again?
How do you respond to how your communities would like to be treated? So I think the question is kind of like, how are there specific ways in which communities would like to be treated during the time of the COVID virus? And I think that's in relation to engagement. Is there anything specific for specific communities? Like I know we heard when we discussed this in the last panelist presentation, you know, with some remote First Nation communities, now is not the time to do the work. Now is the time to maintain the relationships and allow people to focus on what's important. So are there any of those kind of considerations that need to be made specifically that you want to speak to? If not, that's okay.
Well, I think first, the technology is there, but it is not reachable as yet to northern communities, for example. I think we should work on getting those technologies, no matter how trivial, how simple they are, to those communities so that they can engage in, and I think that is the key. And I think one of the, I always hear our president talking about the treaty issue, etc., etc., and then we accept our mistake in the past, but that is just a step over of apologizing. What is the next step? You have to materialize it. You did these mistakes, how to correct those mistakes. For example, you push people up in the north, you left them alone there. make roads, make some communication mechanisms, establish communication mechanisms, this and that. I think this is the key issue. I'm afraid no one at either the federal level, provincial level, or whatever is keen to moving to that direction. That is my personal view, but I think I'm right in this view.
I think that makes sense, yeah. Okay, and I'll make time for one more question here. Question specifically to Abu. What are some ideas to specifically engage the first group of newcomers, those who have been displaced? There's a possibility of missing these voices and perspectives in our work if we are unable to gain their input into some of the work that we're trying to do.
Thank you for the question. Really, for that group of people, the place to get started is with the ethno-cultural community. That's where pretty much everyone is represented. And by that, I mean every newcomer. You will find members of the first group there, member of the second group there. So that will be the first place you want to get started. And then you can branch off to, of course, there is the African Community Associations of Manitoba. This is an umbrella organization that has all of the various communities that are part of. So if you engage with them, you'll be able to reach out to pretty much all the people that you need to reach in the newcomer community. If I might just add one little thing to the question that was before this about reaching out to the newcomer community through during this COVID-19 and whatever. There is still a significant part of that community that does not access technology yet. And I mean, there are people who don't have smartphones. There are households where there's no computer. So you can even reach them remotely. So part of the integration process is to help them introduce them to these, and usually these are people, either they are elderly or they are not, they don't read and write, and so getting them into technology is very, very challenging. So one of the ways to do it is to sort of get started through the younger generation that are around them, to see if you can introduce the technology to them so that they will be able to use it. But it's a process that is ongoing and it's going to take a while. So to substitute for all of that, a phone call will substitute for now. Just say, you know what, we were doing this because of the COVID-19. We can't see you in person. We're just checking to see how you're doing. Again, it comes back to that sense of the person feeling that you care about them, they feel that they are humans, etc.
For sure. Yeah, and what we hear again and again is you don't always have to talk about research when you're connecting. Connect just to say hi and be patient, take time. I mean, even outside of this pandemic, relationships take a long time to build, right? So I think we've had some great considerations. Thank you so much to our panelists for taking the time, for sharing your stories and your perspectives. It's been wonderful. For our attendees, please stay in touch with us. We will send out a quick evaluation to all the attendees and a link to the next session, which is with more of our patient and public partner panelists, Empo and Juanita, on some practical tips and tools for online engagement. So unless anybody has anything else to add, I'll say, I guess we say goodbye for now, and thank you everyone for joining us. All right, goodbye.
Thank you.
Take care.
Bye.
Love yous all.
Love you.
Bye, Thomas.
Miigwech.